The best way to control your pain at home is to wear a compression garment on your leg. That's one of those stockings or elastic ace wrap bandages. Remember, the less swelling you have, the less pain you will have. So wear your compression device, elevate your leg, and apply ice packs. Also, moving your feet and ankles is very helpful to minimize the swelling, which again helps to minimize pain. You most likely will need to take some of the pain medicine that we talked about, but the mechanical control of the pain is very, very important and most times works even better than the drugs that you might take to help control the pain. Starting to move early and gently is also very important. To help prevent infection at home, you need to wash your hands with soap and water before you touch anything on your leg. If the skin around your incision is itchy, don't scratch it with your nails because then the bacteria that can be under your nails can get on the skin and on the incision. If you're itchy, pour some rubbing alcohol onto a washcloth and use that to rub the skin around your incision. Your incision most likely has a glue strip on it, which means that all your stitches are under the skin. The glue strip acts as your bandage and stitches all in one. It is waterproof, so if your leg doesn't have any drainage, you are allowed to shower, meaning you can wash your leg with soap and water. Just make sure it air dries completely before you wrap it up with the ace wrap or put your stuff back on. The way you care for your incision is by keeping it clean and dry. Bacteria, which cause infection, love moisture. So you want to wash your skin and incision every day, but make sure you let it air dry before you cover it back up. If you have a glue strip, that acts as your bandage and your stitches all in one. If you have staples or sutures, which we rarely use these days, but for some patients they are necessary, then you cover those with a dry gauze pad before you put your ace wrap or stocking back on. You can prevent blood clots at home by taking your blood thinner medication as prescribed. Also, the best way to help prevent blood clots is to start moving early and gently. Remember to do pedaling exercises with your feet, to do your exercises as we taught you to do and as instructed by your physical therapist, and to use ice packs and elevation. Things that should make you contact me or my staff is pain that is unrelieved by elevation, application of ice packs, and use of the pain medicine. In addition, if you have a temperature greater than 101, you should contact us. If you have any persistent swelling that does not go away after elevation or that does not go away overnight, then that would be another sign to contact us. You need to have a follow-up appointment with me within 1 to 2 weeks after the surgery. These days, the first few days after knee replacement surgery aren't as painful as they used to be years ago. In fact, the first few days are relatively pain-free. The second week after surgery is when you start to experience some more pain, and that's because most of the numbing medicine has worn off by then. Also, remember that major surgery, which a knee replacement is a strain on your system. You may feel tired, you may feel weak, you may not feel like yourself just because of the medications that we have had to give you to get you through the surgery. 2 weeks after surgery, you should expect to be able to walk around your home and be able to do most of your activities of daily living. At that point, the glue strip or stitches would have been removed, and you should be attending or receiving physical therapy to help with the stiffness in the knee. Remember, knees tend to heal with stiffness, and that's why even when your knee is swollen and sore, we ask you to move it and do your exercises, because we know that the way to have less pain over the long run is to stick with the exercise program during those first 2 to 3 weeks. 6 weeks after surgery, most of my patients are off their walker or crutches. You may need a cane depending upon your physical capacity before the surgery, but basically your knee should be pretty much healed by 6 weeks after surgery. Your strength may not be at your maximal improvement, and you will continue to have ongoing improvements over the next several months. And maximum improvement is usually about a year after the surgery, though each month you do feel better and stronger. 3 months after the surgery is where most of the discomfort from the procedure itself should have resolved. Just about everything in orthopedics takes about 3 months to heal, especially anything that we do with working on the bone. You should be pretty close to your normal function by then if all has gone well and if you have followed our post-op instructions. A year after the surgery is when most people say that their knee feels pretty normal. Remember, knee replacements these days are a technological significant improvement compared to years ago, but it is still an artificial knee. And that feeling of it being different tends to go away by about a year after the surgery, especially if you've been able to continue with your exercise program and maintain good nutrition, good rest, and good exercise habits. Most patients do need to go to outpatient physical therapy. Occasionally, we'll see individuals who do great just with the home instructions. Basically, we have goals that you need to meet at several weeks after the surgery. And if I see that you are meeting those goals by doing your own exercise program, then I may not need to send you to physical therapy. But the majority of patients do need to go for outpatient therapy on average for about a month. Most patients receive home physical therapy through our home health arrangements that were made by the case management nurse at the hospital. Once you have maximized your improvement with the home health physical therapy, which on average takes about 1 to 2 weeks, you either can continue your exercise program on your own or you might need to attend outpatient physical therapy. Your best exercise is walking. It took many years for your knee to deteriorate to the point where it needed a knee replacement, and so all those soft tissues, the muscles and ligaments around your knee, are not used to functioning at that higher level. The way you get to retrain them or get them to function at that higher level is by walking. It doesn't have to be fast, it just needs to be slow and steady and consistent. Many times with arthritis, patients have a limp before surgery. That limping causes them to walk with what I describe as a flat-footed gait. One of the hardest things to obtain after surgery is a more normal walking pattern or gait, which is a heel-toe walking pattern. We teach you how to do this, and we also teach you the stretching exercises for your knee. Your exercises shouldn't be very difficult and painful, especially if you've been following the instructions as how to progress from day to day and week to week. Swelling after leg surgery can last for a long time. On average, that is about 3 to 6 months after the surgery. Some patients can have some swelling for up to a year after the surgery, but the average is about 3 months. Things that affect swelling are if you have a tendency to retain fluid even before the surgery, if you don't wear your compression garments, or if you take medications that affect your blood pressure or fluid retention. Not all swelling is dangerous, and so for the patient, it's difficult to know when it's dangerous or not, and my advice is to contact me or one of my staff members who are very familiar with the recovery process and can help reassure you when necessary and give you advice how to manage the swelling. The severe pain that you may have had before the surgery on average goes away by the 3rd month after the procedure. Pain is very unique and individual, and I have had patients who stopped taking pain medicines a couple weeks after surgery, and other patients who still feel the need for pain medicine a couple of years after surgery. We talk about the pain management protocol for your individual needs, both pre and post-operatively, and we try to tailor it to be effective and safe for your comfort. Walking aids are usually necessary on average for about a month after the surgery. You might be able to get rid of them within a couple of weeks if you have good balance and strength, but I encourage most of my patients to get off of them by a month after the surgery. You are allowed to drive within a couple of weeks after the surgery as long as you can lift your leg up and down without a lot of pain. If you're taking strong pain medicines during the day, which might make you drowsy, then that's the biggest barrier for getting you back into your vehicle. With respect to work, it depends on the type of work you do. If you have a sedentary job, then you might be able to get back to work within about 3 to 4 weeks after the surgery. In the long term, the best way to take care of your new knee is to stay active. The reason you went through a major procedure is to maintain your mobility and independence. Walking is your best exercise, and the other thing you can do to help preserve your knee for the longest time possible is not gain weight. When you gain weight, even if it's just 1 pound, your knee feels like you gained 10 pounds. So weight control, good nutrition, and paying attention to overall good health is very important. For my diabetic patients, I cannot emphasize enough how maintaining good sugar control is important, not just to the healing of your knee replacement, but to preserving it long term and also for your overall health. You really need to know and keep control of your A1C number, and that's also something that we check before the surgery. My recommendation is that you do take antibiotics for at least a day before and 2 days after any procedures like dental procedures or other medical procedures for at least the first year after your knee replacement. After that, we make the decision on an individualized basis, depending upon your risk factors for infection. A late infection is an infection that occurs secondarily, meaning there has been some other process in your health whereby bacteria got into your bloodstream. The most common ways that that happens is from dental infections or from serious infections called bacteremia or sepsis. That happens in many patients, especially elderly patients, when they have urinary infections or other bloodstream infections. The bacteria that causes the infection circulates in your blood, and then it can attach itself or hide on your knee implant, and that's why it's difficult to eradicate. Absolutely. Mobility is life. Without mobility, life is very difficult and not as enjoyable. As we age, our muscles get weaker and they get stiffer. And even though the natural tendency may be to stop moving when you have discomfort or pain with movement, the opposite is actually recommended. You need that slow, steady movement to keep your muscles and joints as strong as possible, whether they're your God-given joints or whether they're an artificial joint. Full recovery after a knee replacement takes about a year. Again, that's when most people feel that the knee is the most natural and that the soreness that they had from the surgery and or residual swelling has pretty much stabilized, plateaued, or most often completely resolved. You usually can resume your preoperative activities around 3 months after the surgery. It's not so much a fixed time because the knee itself is healed by about the 6 weeks after the procedure. But again, getting back to your activities depends on how your other muscles are, how your overall balance is, how your overall strength is. So return to activity is a unique thing in terms of timing and other factors. However, most people can do majority of their both necessary everyday activities and leisure activities by that third month.